Today we will discuss lower back disorders, various of lower back disorders. Many people suffering from lumbalgia, pain in lower back, with no irritating, with no neurological picture, just significant intensive pain in lower back, one side, in the middle, both sides, lower back region pain. Some people suffering from abnormalities known as a radiculopathy, irradiating pain, means on the spinal level, spinal nerves compressed by herniation of disc, bulgings of discs, or combination of compression, irritation of spinal nerve. I should say irritation as a result. Muscles include piriformis, accumulating tension until start on peripheral level to compress sciatic nerve and will awake neuralgia, means neurological pain, most in tooth pains, most intensive pains that we experience. All this considered to be lower back disorders. I always said that massage therapy must be utilized as a preventive effort, being this in stress management, prevention of back and limb disorders. Huge power. If we will look over this skeleton, look, this is the skeletal lumbar spine. 5 lumbar vertebrae. Between them we have intervertebral disc. This is facet joint, and of course here additional 2 ligaments and tendons, muscles. And if somebody is staying gravity, he's staying in gravity, and this gravity on region, on lower back region, include pelvics, sacrum also kind of includes sacroiliac joint, experience this gravity when we stand vertical. Yeah? And for example, gravity will be on this region 150, 200 pounds, no matter how this gravity will be dividing, mostly have to be carried this weight bearing on muscles, of course, and much less on intervertebral disc, facet joint, etc. Now, sometimes people accumulating due to reasons of stress, physical overwork, people working out, involved in sport activities, and do not rehabilitate themselves from overtraining.
The lower back region is a fairly complex anatomical structure. It contains many components such as the intervertebral discs, facet joints, spinal erectors, and rotator muscles. There are also stabilizers like abdominals, including lateral abdominal walls, etc. Therefore, when athletes sustain sprain-strain type injuries in the lower back region, it can result in multiple anatomical component traumas. The lumbar spine region is a very important component of the lower back. It is connected to the sacral region of the spine, including the innervations of lower extremities. The lumbar spine region is composed of vertebrae and intervertebral discs, which in turn is composed of annulus fibrosus, a very strong connective tissue, and nucleus pulposus, the internal fluid. Intervertebral discs supply the shock absorption to the spine, making sure that the vertebrae don't hit each other and contribute to the general range of motion in the region. There are also lots of muscles responsible for keeping us up in vertical positions and allow our bodies to rotate. All of these muscles are attached to the bones by tendons. When the lower back is subjected to a sprain-strain type injury, the lumbar spine region is very vulnerable. When sprain strains happen to muscles and ligaments, all components of the lumbar spinal column are traumatized. These traumas may consist of disc herniations, the development of muscular syndromes, or chain reactions of the neighboring non-traumatized muscles, reacting to these painful localizations by starting to accumulate tension to the pathological level. Therefore, Borge proposes how to perform self-rehabilitating steps that will affect all of these potentially injured components, and comprehensive treatment that stimulates the healing process of the entire lower back region.
The role of post-event support rehabilitative massage is to manage this exercise stress side effects. And let's say if this not managed, and this 200 pounds, and when muscles accumulate tension, they demonstrate insufficiency. Means this 200 pounds will sustain, but will be dividing more, will go on intervertebral discs, facet joints, ligaments involved in it, etc. Now, with time, muscles will accumulate so much tension that will produce muscles, and with time, fascia will accumulate tension that will produce significant pain. We call this myofascial pain. People coming to the doctor, I have terrible pain, they do MRI, I'm like, no, you don't have problem. And people were happy, I have no problem, but he cannot function, he cannot live normal life, he cannot sleep, every movement causing him pain. This is myofascial pain, cannot be detected by radiological means on palpation. We do perfectly well in this case, is very effective with performing connective tissue massage, we're performing in kneadings, we're performing the other stuff that helping us to fight these myofascial tensions. Now, with time, because discs start working overtimes and facet joints, overloads start compensating this weight bearing, the inside of disc nucleus start dehydrate. This is empty in case, of course it's not, there is inside fluid, peripheral annulus fibrosis. This is ring that hold and causing this shock absorption, preventing vertebrae to hit each other, preventing too much load on facet joints. Yeah, but due to overwork, compensatory weight-bearing work, this inside nucleus start to dehydrate, and little by little it start bulging, because less mass quantity of this fluid within nucleus, and this is bulging. But people continue to use, and muscles will kind of accumulate more and more tension, will demonstrate insufficiency, and this bulging, little by little, will so weakened inside the microscopical fissuring that one day it will, the fragment of nucleus pulposus will herniate, it will tear and will come out and will say it will compress. Of course, bulging also can irritate or compress the spinal nerve, and this is not pleasant stuff. This is, you see, the nerve will be compressed, a reflectorial spasm, edema immediately, accumulation of excessive amount of extracellular fluid, venous blood, so there's all this stuff. Now, guys, if we will take somebody with myofascial pain syndrome, and we'll start providing our therapy, we will bring muscles to the function, and with this, we will prevent further pathologies such as herniation of disc, and of course, we will slow down the process of osteoarthritis, spondyloarthritis within facet joints. This is what happened. If there's a lot of young people today, due to vigorous exercise, developing arthritis, degenerative type of arthritis with the knee and spinal joints, shoulders, because of overuse and not rehabilitative treatment. Massage therapy is and special post-event rehabilitative sport massage contain significant power of rehabilitation, prevention, rehabilitation of these side effects, management of microscopical scar tissue. And here, as you see, my facial pain is a precondition of development of severe osteoarthritis, maybe spinal stenosis, and herniation of disc. But even in the case of herniation of disc and all these negative phenomena, we can be very helpful. On my DVD number 1, I am proposing all these techniques. Difference. Now you will see a segment from my DVD number 1. I little bit will repeat it there. It was necessary kind of clarification, therefore I spent this time. You will view this fragment from my DVD number 1, and I will come back to you.
In any case of lumbar spine disorders, given to the fact that lumbar spine have kind of lordosis, it's very important to place, as you can see, I place a pillow under stomach to avoid hyperextension. In some cases it can cause a reflectorical spasm, hyperextension. Don't forget, we will apply pressure, and we will potentially will increase a little bit the lordosis. Therefore it's important to put pillow under patient's stomach. The first step with both thumbs, kind of like you try to push away paravertebral muscles, or in circle motion, or just like this, 7-8 times from LS region. We'll work on paravertebral zones. Next step we will do, if this is unilateral irradiating pain or pain, we will do on one side, but I do recommend to stimulate the unaffected side also. Petrosage number 1, and include glutes muscles. And in this case, as you can see, I a little bit shift the glutes by performing petrosage number 1. I remove a little bit, and this is actually under glutes, location of piriformis muscles. And under piriformis muscles, located find pathways, sciatica nerve, and over-tense piriformis muscles can produce irradiation in sciatica neuralgia. And we will affect a little bit with petrosage number 1 also all this lumbar sacral region, SI, sacroiliac joint. We will perform petrosage number 1, approximately 5-6 minutes. Petrosage number 2, hand after hand. And 3-4 times on one location we go. You see, it's allowed me to stimulate deeply and deeply and deeply. And this is to awaken reflexes in the form of muscular relaxation with back of the fingers. But what is very important, to spinal process is not to touch. Just, you see, if you paid attention, my proximal phalanges moving really paravertebra, like this. This technical approach, initial pressure have to be applied, and again, about amount of pressure you have to consult your client, like initial pressure, to ask him how the pressure, and after this to proceed to not to overdo. But in any cases of disorders mentioned above, if there's herniation disc or spondylosis involvement that produce painful symptoms in lumbar sacral region, venous blood accumulation is like a part of these disorders. And venous blood accumulation in this region is an additional cause of pain production. We can pretty intensive to do something like this. Yeah, but I would like to recommend, in special, if this technique's not so familiar for you, to do slowly. One step, to make sure that you locate it between paravertebral, but on the right side, not on the other side. Otherwise, it can cause injury. If, for example, we mobilize paravertebral muscles on the left side of column, like in this side, you will stay here, and you will make sure that your phalanx located on the left side between spinal processes and paravertebral muscles, like this, and push away, like this, and push. Apply initial pressure and just stretch as much as possible, stretches including glutes, and including changing the direction a little bit under glutes muscles, mobilizing piriformis muscles. And again, this is very important techniques that, again, we're making sure we don't applying initial pressure on the spinal process. We just nearby. We exchange with the elbow, with tip of the elbow. We're applying initial pressure, and again, how much the pressure, it matches he can tolerance, and muscles don't protecting in spasm. Applying pressure, and we stretching like around pelvic, so it's like a butterfly pelvic, to stimulate piriformis muscles and to reduce tension and of course compression of sciatic nerve. In case if a trigger point will be detected, we have to flex our elbow, and in this case I do recommend to utilize, to prefer the stimulation of trigger point by elbow. It's a very massive presentation here.
I hope that you enjoyed in general my presentation on this fragment. On my DVD number 1, I proposing comprehensive approach to this, include trigger point therapy and etc. Additionally, post-symmetric relaxation, very important techniques, are proposed as well. Rehabilitative exercise. It's needed when pain sensation go down and the plus-minus alliance fascia and muscles is normalized. It is very important to implement exercise to build up a little bit muscle mass and to sustain a normal resting tonus.